Beyond the massive health implications, the Wuhan pandemic has upended our lives. It's thrown our economy into a complete tailspin, let's face it. Well, it's worth quickly reviewing what we know and what we still don't know about the current outbreak. Now, for starters, we know that COVID-19 is only the latest coronavirus to infect and kill people across the globe. We know what happened with other coronavirus outbreaks. In November 2002, SARS, or severe acute respiratory syndrome, was discovered in southern China. It infected more than 8,000 people worldwide and had a death rate of 10%. No one died in the U.S., and it was largely over by July of 2003. The first case of MERS, or Middle East Respiratory Syndrome, occurred in Jordan in April 2012. First thought it was from Saudi Arabia, then it was linked back to Jordan. It spread, believe it or not, through contact with camels and close person-to-person interactions, such as caring for an infected person. Now, more than 2,400 were infected globally, with over 850 deaths. Only 2 cases were ever found here, both in healthcare providers who had traveled to Saudi Arabia. The case fatality rate was approximately 35%. Well, and then, of course, there's the newest viral beast, COVID-19. So far, these are the stats. The virus is in more than 150 countries and territories, with nearly 200,000 infected, nearly 8,000 deaths. In the U.S., we're just now ramping up testing, thank goodness, and so far we have nearly 6,300 infections and 105 deaths. And we know that most of the victims are elderly or otherwise infirm individuals. But there are many important questions about this virus that remain, and the answers are going to tell us whether the mediation actions we've taken, the sheltering in place and what we're doing now, were right or wrong, too much or too little. Number one, the true mortality rate. As The Guardian reported today, quote, "We don't yet know how dangerous the new coronavirus is, and we won't know until more data comes in. Estimates range from below 1% in the young to over 14% among seniors or the medically compromised." Now, here in the U.S., it seems that the more we test, the lower the mortality rate. That makes everyone feel a little bit better, doesn't it? Well, that graph tells the story. Number two, contagiousness. People are terrified they're going to get the disease by just walking by someone on the street or in the grocery store and going out to get milk, or by sitting next to someone in a doctor's office for just 5 minutes. But Dr. Richard Martinello, an infectious disease specialist at Yale New Haven, said, "There's still so much to learn about how this pathogen is transmitted between individuals. Data is needed not only to better understand when those who become ill shed the virus, but also which body fluids contain the virus and how those may contaminate surfaces and even the air surrounding them." There was also an important study conducted by Stanford researcher on the confirmed instance of the virus spreading person to person in the U.S. It was a woman in her 60s who returned to the U.S. from China in mid-January. Of her 372 traced contacts, a study published in The Lancet found that they've only detected transmission of SARS, the specific name of the disease, that's the coronavirus we're talking about, in a single household contact with frequent, prolonged interactions with the index patient. That's interesting. Out of 372 contacts, only one person who basically lived with her husband, got it. Number three, why some people get sick and some don't. We don't know why some of those infected experience only mild cold-like symptoms that resolve on their own, while a significant minority of those infected may have serious symptoms that lead to pneumonia and even death. Now, one theory is that the severity of symptoms is linked to the strength of a person's general immune system, but that's just one possible explanation. Number four, patient zero? We still don't know who the first patient was who contracted the virus in China. Now, that's a key fact that a lot of researchers say is essential to the analysis of this disease. Now, we first heard that it was like late December, then it was December 1st, and now reports take it all the way back to November 17th. Now, this means that the coronavirus started spreading for weeks before the first cases were officially reported by China. And that brings me to the question number 5, trusting the Chinese. As soon as word got out about this new potentially deadly virus, the CCP began to crack down on journalists for doing their jobs. For example, the New York Times reported in January that when a group of Hong Kong journalists went to the Wuhan hospital that took in most coronavirus patients, the police detained them for a few hours. They were then asked to delete their TV footage and hand in their phones and cameras for inspection. And today, China announced that it was expelling American journalists from the New York Times, the Washington Post, and the Wall Street Journal. They cited ideological bias against China, fake news made in the name of press freedom, and breaches of ethics in journalism. Well, China's motivation here, folks, is obvious. It further allows them to deprive us and their own people of real information, accurate information on what the heck is going on and what happened originally with this coronavirus.
I regret China's decision today to further foreclose the world's ability to conduct the free press operations that, frankly, would be really good for the Chinese people. In these incredibly challenging global times where more information, more transparency are what will save lives.
And speaking of saving lives, we still don't know what the fate is of the 2 citizen journalists who disappeared last month after questioning the government's response to the virus. They're just gone. Question number 6, China's relationship with the WHO. Remember, China is co-founder of the World Health Organization, and it provides an enormous amount of funding to it. They're now the 2nd largest donor after the United States. But somehow they seem to be pulling all the strings. CNN's reporting that the WHO's praise of China's response have led critics to question the relationship between the 2 entities. Perhaps one of the most overt examples of China's sway over the WHO is its success in blocking Taiwan's access to that body, a position that could have very real consequences for the Taiwanese people if the virus takes hold there. So when you hear of officials here, or journalists even, commentators lauding the Chinese containment of the virus, take that all with a very large grain of salt. And remember, while we're wise to heed expert advice from trusted U.S. sources during this time, we should also remember that there is a lot we do not know, and a lot of information coming from China that we frankly cannot trust. And that's the angle.